My name is Dr. Anoop Patel. I'm a cardiologist at the Sandra R. Berman Heart Institute at the University of Maryland St. Joseph Medical Center. So valvular heart disease is a group of conditions that affect the structures that separate the four chambers of the heart. We have four valves, right? And there is a group of disease pathology that can affect any of these heart valves. When we talk about disease and the valves, the biggest issues that we run across is either the valve has become stiffened or stenotic, or it's become leaky or regurgitant. And this is a result of a degenerative process that occurs with the heart valves. The things that can cause valvular heart disease are either calcific or deposition of plaque on the heart valves, or it could be things like infection or trauma, congenital conditions. People are born with these things. It can be a result of genetic abnormalities with the building blocks of the heart valves. Anything can cause valvular heart disease. The important part of addressing valvular heart disease is to identify the condition early on. And so you can work with your cardiologist to not only understand the natural history and the way that the disease progresses from being a mild disease process to a severe disease process, but to recognize these symptoms and intervene early if it's appropriate, to prevent your heart from becoming weak, which is ultimately what we want to try to avoid. So when we are referred patients, when patients have symptoms and they've talked to their primary care providers or they've been seen in the emergency department, and they have symptoms that would suggest valvular heart disease, we as general cardiologists, we see the patient in the office and we help try to make that diagnosis. And we make that diagnosis by talking to the patient, hearing their symptoms and how their symptoms have progressed. And then we move forward with imaging, and we traditionally start with an ultrasound of the heart or an echocardiogram. And we use that to try to diagnose valvular heart disease. And when we diagnose valvular heart disease, we assess whether or not it's mild, moderate, or severe. And those patients that are severe and symptomatic, those are the ones that we identify that need some sort of intervention. So when we talk about aortic stenosis, traditionally, the way that we replaced aortic valves was surgically, open heart surgery. And there were really two options. When people had symptomatic aortic stenosis, you either had open heart surgery or there was no option, and there was palliation. We tried to treat with medications. With the advent of the transcatheter aortic valve replacement, or TAVR, we're able to take patients that are higher risk for surgery, which traditionally most folks over the age of 80 are, because of various other conditions like lung disease or kidney disease. We've created a minimally invasive intervention where you can replace the aortic valve and give these patients back some quality of life and even survival when they have severe aortic stenosis. When people undergo TAVR, they're typically having symptoms, whether it's losing consciousness, whether they're having chest pain, whether they've had shortness of breath or fatigue. Some people even have congestive heart failure symptoms. And so what you see oftentimes immediately post TAVR, the first day, some people notice an improvement in the way they breathe. But for the most part, most of the people, they undergo cardiac rehab. Sometimes the day after they have their aortic valve replaced with a TAVR, they notice that their breathing is better, right? They're feeling less lightheaded. They feel that the energy levels are improving. And for the most part, we see patients have a gradual improvement in their symptomology. We set people up for cardiac rehab. They go through the process where they're reconditioning their heart, they're becoming more active, and for the most part, when people get through this whole process, they notice a significant improvement to their quality of life. And when you've had symptoms of aortic stenosis, we're talking about an improvement in survival. We recognize that there are multiple options to get cardiovascular care in the city of Baltimore. The University of Maryland St. Joseph Medical Center, it's a place where people can come locally to receive comprehensive care. When we talk about comprehensive care, we're talking about care that's compassionate. Everyone from our secretaries in our office to the cardiac surgeons are all focused on providing and making sure that patients' families and their patients are comfortable. This is our passion. This is what we love to do. We love to guide people through this process and make sure that they feel confident and comfortable in what they're receiving in terms of their care. This is the place to come for cardiovascular care.